So we will now discuss about the anatomy of the breast. The breast, as we all know, is a modified sweat gland. So the extent of the breast is of great importance because surgically our dissection, all pathologies have to be addressed based on its position in relation to the breast. So the breast extends anteroposteriorly, or it extends superior inferiorly from the second intercostal space to the sixth intercostal space. Medially, it extends from the lateral border of the sternum, and laterally it goes until the mid-axillary line. So this will be the mid-axillary line. So this will be the lateral border of the sternum. So this will be the mediolateral extent of it. Superior inferior extent of it will be from the second intercostal space right down to the sixth intercostal space. You can divide the entire breast tissue into 4 quadrants. Okay, by drawing a line across transversely and longitudinally. So this with the intersection point being at the level of the nipple. So the nipple usually is located around the 4th intercostal space. So that is where the nipple is usually located. Now, based on this division, you can divide the breast into 4 different quadrants. So this will be the upper medial quadrant, this one will be the upper lateral quadrant, the lower lateral quadrant, and the lower medial quadrant. So this is very important because in this particular era of breast conservation surgeries, having a good understanding regarding these quadrant division of the breast is of great importance. Now, you notice this small tail-like structure here. So this tail-like structure located in the upper lateral quadrant of the breast is called as the axillary tail of Spence. It's called the axillary tail because you find that it extends through a foramen called as the foramen of Lange. It extends through a foramen called as the foramen of Lange into the axilla. So while doing a mastectomy, this particular axillary tail of Spence might also have to be removed along the specimen. So the extension of the axillary tail into the axilla is of great importance, and it occurs through a foramen called as the foramen of Lange. Okay. Now, so that is with regard to the relation of the breast. Okay. To the landmarks which are related to the breast and its extent. Now, the breast, we all know, rests on a facial plane as well as deep to it have muscles. So the breast rests on what is called as the pectoral fascia. So you can see here, this is the pectoral fascia. The breast rests on the pectoral fascia. In between the pectoral fascia and the breast tissue, you have a large amount of loose areolar tissue. It is because of the presence of this loose areolar tissue that the breast is so mobile. It is freely mobile because of the presence of the loose areolar tissue, which separates it from the pectoral fascia. Deep to the pectoral fascia, we have the muscles. So, the most important muscle it is related to is the pectoralis major muscle. As we come to the lower quadrants of the breast, you find that it is related to the external oblique as well as the serratus anterior. So, the upper aspect of the breast is related to the pectoralis major. The lower 2 quadrants of the breast are related to the external oblique medially and the serratus anterior laterally. So this is again very important when we are planning for a surgery involving the breast and also with regard to certain pathologies which involve the breast.